When feeling sick, it seems obvious to most to visit a doctor. We trust these people to be medical professionals who know the human body and thus can offer us proper treatment and medications to help us get well again. But now imagine yourself unwell but unable to access this help. Not because it isn't there, but because you're terrified of what might happen if you do. This is called pharmacophobia. Many are actually surprised to learn that they have this phobia and that they aren't alone in their fears. It's not a very commonly known phobia, despite how commonly it can be experienced. So please do stick around to learn more about it.
An idea
could escape.
Ideas are bulletproof.
Hello everyone, welcome back to ALifeLearned. My name is Becca and today I want to talk to you about pharmacophobia and how difficult it can be to deal with when so little people seem to know about it. This condition is basically a fear of medications and or medical treatments. And while most all adults who deal with this phobia are aware that their fears aren't rational, they are still faced with exceptional dread, anxiety, or even panic attacks when even thinking about approaching them, let alone trying to approach the idea of taking a medication or seeking medical treatment depending on the degree of their condition. I'm thankful to say that in my case, I'm only afraid of new medications or the side effects of psychopharmaceuticals, which would be generally a rather minor case of pharmacophobia compared to how some people can be afraid of doctors or any type of medication at all. There are different ways that someone can develop this condition. In my case, I actually developed it out of over-educating myself about the various different side effects that are possible, as well as over-educating myself about the biology of my body, combining that with education of pharmacare, really being more focused on selling pills than trying to help people, and then combining that with a bad experience from a medication. All of this has led me to be very afraid of side effects, to the point that I am paranoid of what might happen and would almost rather die than try a lot of antidepressants that are offered to me for the conditions I have. But this condition can be developed for a lot of different reasons. Some parents actually develop it out of fear of their children taking medications and developing a fear that the medication for some reason might have a more adverse effect rather than helping their child recover. And in this way, the condition can actually be contracted in a hereditary fashion, in the sense that children can learn the phobia from their parents. It can be a learned behavior. It's also in many cases been traced back to a specific traumatic event in people's past, and in other cases these traumatic events can combine with other hereditary issues such as chemical imbalances, which can also contribute to developing the condition. And it's actually not uncommon to develop this condition as a result of experiencing adverse effects from a medication that was prescribed to you. In my case, it was actually just an antibiotic, but it was from a local hospital where the doctor was quite awful in terms of bedside manner, and this can frequently result out of doctors not taking patients' histories into account and thus prescribing them medications that don't properly suit them and thus have very adverse effects and can be really difficult to deal with, as it can ultimately change your body entirely, and that's a really hard thing to get over, particularly when having to consider taking a new medication. In a similar fashion, people can also develop the phobia from experiencing bad withdrawals from psychotropic drugs, or people can misassociate symptoms from their disease as symptoms from the medications that are treating their disease. This is actually the easiest type of pharmacophobia that can be treated, because it's a lot easier to show the patient by removing the medications how the side effects are from the disease and not the medication. So for someone dealing with this phobia, it can range from having a fear of one or all of the following. It can be as simple as an intense fear of becoming addicted to medications or taking new medications at all, referred to as neopharmaphobia, which is something I do deal with. Or it can extend into a fear of taking any medications at all, receiving injections, or even visiting a doctor in any sense. And as with any phobia, the symptoms that are experienced by each person vary depending on how intense the fear is for you, but generally it's anything associated with anxiety or panic-based disorders. So things such as dread, shortness of breath, rapid breathing, excessive sweating, irregular heartbeat, dry mouth, nausea, shaking, inability to articulate words or sentences, becoming mad or out of control, a sensation of detachment from reality or dissociation, a fear fear of dying, or a full-blown anxiety attack, which can be different for different people, but is generally completely debilitating. So when facing such intense symptoms, it's rather reasonable to see why these people might avoid medical treatment. But left untreated, this pharmacophobia can really lead to terrible physical and mental degradation, and even lead to someone's hygiene falling off, because overall they just won't address the different problems with their health out of fear of what might come of it. And so this obviously means that if these people ever need procedures and they do end up in the hospital and getting the procedures, they often tend not to take care of themselves properly after those procedures as well, which again leads to a degradation of their overall health. And so of course, no matter how minor the case might be, this isn't something that can be left untreated, because it will only get worse. And though it isn't a very well-known condition, thankfully there are a few treatments out there that are known to help with it, specifically hypnotherapy, neurolinguistic programming, and something referred to as energy psychology. Hypnotherapy is said to reprogram the parts of your subconscious that are said to make up your fear. When these areas of the brain are debugged or reworked, it's often said to help minimize the pharmacophobia symptoms, and is overall thought to be a very safe and fast-acting way to approach the problem. But many people don't like the idea of someone meddling in their brain in that sense, because they aren't fully conscious. So in that case, you can always consider neurolinguistic programming. Neurolinguistic programming is very similar to the hypnotherapy approach in that it assumes that there are programs or sections of your brain that aren't working properly in order to associate the fears that you have. In this approach, the constructs that you've developed around the fear are revealed and in a sense reprogrammed so that it helps minimize and in many cases eliminate the pharmacophobia symptoms. And similar to hypnotherapy, it's found to be very fast and effective in how it helps treat the condition. So definitely something worth considering. But if neither of those sound like something that might work for you, you can always consider energy psychology. This approach is emerging as an excellent therapy for addressing fears and phobias. It's based in a theory and practice that's been around for a couple thousand years, with the same roots as acupuncture, though without the needles. And so in that way, it's actually sometimes referred to as emotional acupuncture. And like the other two approaches mentioned, it's said to be very safe, effective, and long-lasting, so definitely something worth considering if you're dealing with this condition. But everyone is different and everyone receives things differently, so if one of those options doesn't seem like something that might suit you, definitely do some more research to see what else is out there. There might be other options that could suit you better, or maybe just reading up better on one of the options I mentioned might make it sound a little more appealing to you, because I did just try to summarize them very briefly. So do a bit more research if you think you might have this condition or know someone else who might have it. And I know that can be a very difficult thing to get to. Just deciding that you're ready to approach a fear is a huge step. So try not to push yourself too far. You don't want to push yourself into a panic attack, of course. As I mentioned, a lot of people just have panic attacks and even just thinking about approaching their fears. So take it one step at a time, but do know that it does need to be addressed. It can't be something that can be allowed to fester, because left untreated, it really could lead to someone's early death, and we definitely don't want that. So if possible, do visit a medical professional to see how you can approach trying to address your pharmacophobia. And if it is so intense that you don't feel comfortable going to see a doctor, there's always online physicians. That's definitely an option. Or you could maybe ask a friend or family member to come with you to go see a physician. Oftentimes having someone there that cares about us does help us a lot in dealing with anxious situations. So definitely something to consider. As someone dealing with this condition, I know how difficult it can be to seek help for it. I mean, a lot of the times doctors don't even seem to know about it when I go to speak to them about it. And that can be really scary when trying to get help, because when a doctor doesn't even validate the experiences that you're having and the symptoms that you're genuinely experiencing, it can be really scary to try and figure out how to address the condition on your own. In a lot of cases, people can actually be scared away from doctors because they tried to approach them about their pharmacophobia and received absolutely no compassion or understanding whatsoever. And so out of a result of basically bad bedside manner, these people's pharmacophobia is made even worse. And so the lack of awareness of this condition has created a significant amount of stigma around it, because even those within the mental health community often don't know about it and thus are very confused when hearing about the idea of being afraid to seek medical attention. And when those even within the medical field don't seem to know what you're talking about, although you can research and find plenty of information about it, so it is a real condition, you can just feel really alone and scared, and when it can be a condition that can ultimately lead to an early death. That is even more scary to think that stigma is keeping people from getting well and from dealing with this condition. So with that, I ask you to please do share this video with anyone you think might be dealing with this condition. And if you think you yourself might be dealing with some variation of it, please do more research and reach out for help. Even if you can't reach out to a doctor or some physician at this time, try to reach out to a friend or family member just so that they can know you're going through this and they can try to start helping you in working up to getting help for it. And then when the time does come that you feel able to seek help from a professional, I highly advise going to someone who knows psychology, not just a family doctor, so a therapist, a psychiatrist, or something along those lines, because they stand a much better chance of actually knowing about this phobia and thus having better ways of helping you address it and treat it. Like any other mental health issue, it's one step at a time, but it can be treated. We just need to support each other, be compassionate, and share awareness so that more people understand about this condition and about different mental health conditions like this. And for anyone else watching, even if you don't have this condition or know anyone who has this condition, please do share this video because it seems to be the least commonly known mental health condition I've come across. And as someone who's dealing with it, I can attest to the fact that it's really hard to get help, support, and treatment at all when others don't seem to know what you're going through. It's very lonely and scary, and thus we want to reduce that experience for anyone else, of course, and try to spread the awareness and spread the help so that people stop suffering from this and get treatment as soon as possible. And if you have anything you'd like to comment below regarding having the condition, or someone you might know who has the condition, or maybe you're unsure if you have it and you want to have a conversation about that, I'm certainly not a professional, but I can offer advice and maybe steer you in the right direction of how to get some good treatment. So please do feel free to comment below, and as always, join me again next week where I try again to share a little something I've learned in life.